go that far.
Nah.
Okay, let's not go that far this morning. Hi, ladies. How are y'all?
Good.
Fine, Al. How are you?
I'm okay for a Thursday, I guess. So don't worry about that right now, okay?
Okay.
We'll deal with that later.
Okay.
You got a show to do.
Right.
That's just secondary stuff.
And we have a sponsor.
You do?
Yes.
And I've got his ad.
Really?
I do.
Yeah.
On my phone.
Yeah, we are Common Sense Matters here, sponsored by
on?
the Franklin County Democratic Party, and we have another sponsor, and Betty's going to tell us about him.
When looking for a real estate, guess what? When looking, it's on my phone, phone.
You can do this, Betty.
I know.
Yeah, I know we're challenged with this stuff.
When looking for a real estate agent, call Mike Quinton with Keller Williams at 931-224-5969. 10 years experience and lifelong knowledge of our Middle Tennessee area. He has been the Sears manager in Tullahoma for years.
Right.
And he has sold that franchise, and has gone into the real estate business. But he's not new. He has 10 years experience. He has also done that while he's worked at Sears.
Gotcha.
Okay. Now, shall I tell what I just told you about the young man who has connections here?
It's your show. If that's what you would like to do, it's fine with me.
Well, I was just real thrilled to learn yesterday that Mark Esper, who is married to Leah Lacey, has been nominated as our Secretary of the Army, and it looks like it's a done deal. He's already been interrogated and so on, and I was just real thrilled to hear that we have someone in the cabinet who is connected with Franklin County.
I was going to say, some people might not realize who this is and the connection here in Franklin County, because we got a bunch of newbies here.
Well, Vaughn Lacey taught with me at the high school for years. Tommy Lacey worked at Arnold Center for years, and they still live here, but they spend the winters in Florida. So I was just real thrilled to learn that.
She was one of the outstanding English teachers that we had in Franklin County for many years.
Taught junior English for many years, and had a real good sense of humor.
Yep.
I remember Vaughn from high school. She was a classmate of mine, and I remember Vaughn as being very smart, and I can see why she'd make an excellent teacher.
Yep. And, of course, this is her daughter that graduated from Franklin County High School.
And played basketball.
Yep. And was a great youngster.
Oh, yes.
A great youngster. So this is great news. If her husband can land this deal, that's really cool that we got a little local connection now.
Yes, it is. And he was a graduate of one of the military academies, I think. And he has been in a think tank for years for the Republican Party, and he's real close to John McCain.
Okay.
From my understanding.
All right. So, pretty cool news with a little local touch there. All right, so you guys have been busy, haven't you? A lot of stuff going on.
Yes. Well, Betty, you want to talk first, and then it's insurance time. People are signing up for insurance, so I want to get a word or two in about health insurance.
But there's a little meeting Saturday, isn't there? A little get-together Saturday?
Not this Saturday.
There's not.
It's the 18th.
Is that next week, the meet and greet?
No, we had a meet and greet Monday night of Craig Fitzhugh, who's running for governor.
Okay, so I missed that one.
But November the 18th is our next meeting. But what I want to talk about has nothing to do with Democratic politics, except I want to explain to people, I think there's a misunderstanding about the refurbishing of the square in Winchester. Some of the downtown people who are on the committee said that they were getting a lot of flack from people who thought that money could be best spent somewhere else. Mm-hmm. And they think that it has come from the general public of the taxpayers and it shouldn't all be spent in Winchester. When my husband was state representative, I'm going to tell you from the day one, Governor Phil Bredesen came to town, and we were in the building, the old Prince Drugstore building, and I don't remember what restaurant was there at the time, but that's where we had the meeting. And Beth Roten came to me and said, Miss Fraley, could you get me an audience with the governor. I said, well, certainly, I'll introduce you to him and tell him you're administrator, city administrator. So I did that, and she said, Governor Bredesen, I want you to step out on the sidewalk with me. And so we went out on the sidewalk, and she said, now I want you to look at this town and look at these sidewalks, and we need a facelift. And he said, well, I'll tell you what you do. You get somebody to write a grant, and you get your representative to push that grant, and we'll see what we can do. He didn't promise her, but said, we'll see what we can do. So Yvonne Stewart wrote a wonderful grant. Governor Bredesen said, when you see George Fraley coming, you just may as well get yes on your lips, because he's going to torment you and persevere until you say yes. So this was one of 6 towns in the whole state of Tennessee that was able to get that grant, and that grant consists of sales tax money from the city of Winchester that we would have to send to the state of Tennessee, and it would be theirs. They have allowed us to keep our sales tax money in the city of Winchester until 2022. So this refurbishing is going to go on until 2022. Now, George had nothing to do with the way the money was spent, but it is here to refurbish the square in Winchester, and it belongs to the sales tax payers in the city of Winchester that would have gone somewhere else to another town if he had not pursued it, and if Yvonne and Beth Roten had not had the idea and Yvonne had not written the grant. And I just want people to understand that this is not money that could have been, it's Winchester's money. So it could not have been spent somewhere else.
Right.
Governor Bredesen also said of George that he was a workhorse and not a show horse. And he really did work hard for this area, and I'm so proud of the square, and I want people to understand that the money is not money that could be spent in the school system, or it couldn't be spent on the roads or whatever. It's money that belongs to the citizens of the city of Winchester.
So between now and 2022, the more money that's spent in downtown Winchester area, it will help make the other things that they want to do in downtown. It's like, what, a 9-block radius, I think, or a 6-block radius?
See, the part that goes up the hill, I think, is called the Gateway.
Mm-hmm.
So all of that, yes, is as a result of that grant.
That's pretty cool. You know, a lot of people get upset about some of these projects.
Yeah.
And a lot of them are all grant money that would be going somewhere else if we don't land it.
That's right.
And we don't use it here. So we're not changing, our local budgets. We're not taking money from Peter to pay Paul.
No.
So this is money that is above what we would not have unless we went and got it.
Well, somebody just innocently put on Facebook that they didn't understand, and the man did not mean to. He didn't mean to stir up a hornet's nest, but when he just simply asked, where is all this money coming from, then a whole lot of people got in on it, and they were just real upset about it. So I just wanted the general public to understand that it is not money that could be spent anywhere else. It belongs to the city of Winchester. And if they hadn't used it, it would have gone to Tennessee, the state of Tennessee, and we would have never seen it again.
Right. So, good news.
Well, I've wanted to explain that for some time, and so since our guest didn't show up today, and our guest is an unannounced potential candidate, but he had a conflict, and so he didn't come, so I don't feel at liberty to say who he was, but he is a potential candidate, and I'll let him do the announcing when he gets ready.
I got you. I'm with you on all that. Health. Holy moly. I went and did mine. I redid mine.
Okay.
Whether or not I've done the right thing with what I've done, it's changed. My options were totally different this time.
Is that right?
Than what it was the last time. They said, well, you can do the same thing, but it's really not the same thing. Mine went to a zero payment a month.
Good deal. Yeah, I was glad to see when I first checked the premiums that Blue Cross Blue Shield still has those zero premiums up to certain level.
You know, I think all of mine was pretty much that way, or it was going to cost me either the zero premium or it was going to cost me $300 and something a month. You know, those are like my two options that I had. Of course, the other side of the coin is whatever I get, I'm going to have to give it up in 2 or 3 months because I'll turn 65 in April.
Oh, yeah, right.
So, you know, so it's like I got to have it for like 2 or 3 months.
Yes, sir.
You know.
Yeah. You'll join Betty and me in Medicare, and then get you a good supplement, and you're good to go.
I don't know. That part scares me. You know,
Why?
is getting, I guess, learning and getting the right program.
Well,
you know,
you just do a lot of research, which I did. I'll be glad to help you and tell you what I chose. You know, and I did a lot of research. I went to several drugstores and asked several druggists, and I mean, I did a lot of work before I decided.
Yeah, that's the prescription drug plan.
Yeah.
It is very confusing. The supplemental plan, and Betty and I, fortunate enough to be in the state retirement system, got POMCO, and that my Medicare and POMCO card takes care of virtually
Almost
everything. Right.
I think George's stay at Vanderbilt maybe cost me $300.
That's cool. You know, but you know, we tried Monday to explain the donut hole, you know, to people. You know, and I don't know if we did a very good job trying to get that explained or not, but we worked on that.
It's not easy to explain, but it's a serious thing, I'll tell you.
Yeah.
See, I used to go to the donut hole in October. Then after October, I had to pay for all of my medicine.
Wow.
All of my medicine. I've changed where I buy my medicine, and I'm not going into the donut hole anymore. So yes, you have to be very careful about that, because I was paying $500 a month from October until the end of the year.
But isn't that one thing that the Affordable Care Act did? Betty got rid of it.
I don't think we have a donut hole anymore.
I don't think we have a donut hole anymore. I think the ACA.
I think the way we talked yesterday, or Monday, with a representative from an insurance company here in town that came in and tried to explain that there are still, you know, donut holes that are out there. You just got to be careful of what you end up with.
Did you wind up getting a silver plan?
Yeah.
Yeah. Okay.
Yeah.
Silver plans are what most people should get, unless their income falls way over. There are other options.
Right.
I was reading just this morning, brushing up on some things, and that there was this one article I read that went into, you have to shop around, and it does get complicated, but that people who didn't expect to be using a doctor, it's just a nuisance to them to get insurance, you know.
Right.
Well, go ahead and get the bronze plan, which hardly pays anything, and medical providers may not accept. I've heard that's the very cheapest plan that pays the very least, but of course it's cheaper.
Right.
And then there's even the gold plan that you pay high premiums but get lower deductibles.
Right.
So, but if people have, and this is one thing that'll just take me into this, people with incomes up to 250% poverty level, I'm looking at a chart here, for you get extra, you've heard a lot said about cost sharing reductions. Up to 250%, you get extra help with deductibles and out-of-pocket premiums, and that's where a silver plan is really advisable, up to that 250%. But what I wanted to mention first is of course, we're in an enrollment period right now for the Affordable Care Act. You got to do it by December the 15th, or you're out of luck, unless you have a special enrollment period event, like you have a new baby, you get married, you get divorced, you get out of jail, you moving from one county to another. We'll do it. You get a 60-day period that you can enroll. Losing insurance, losing health insurance because of quitting your job, losing your job. is gives you a special 60-day enrollment period, and sadly, I've heard from some people that didn't realize that, and they'll call me about getting this the health insurance way past maybe the 60-day period, past the period. So people need to know, if you lose insurance, your health insurance that you have now, you get a 60-day enrollment period. Another really important thing I want to point out is children. Children especially, and Cover Kids and TennCare. And you can sign up for Cover Kids, TennCare, Medicaid anytime. You don't have to wait. There are no special enrollment periods. Anytime. And if you've got children, I have a chart here, and y'all grab your pencil, and so you can write this down. I want to tell you how to get to a very, very helpful chart online. And I'll tell you again in case you miss it now. Just type in your computer address place there, eligibility, like ELIGIBILITY, and then REF, guide, GUIDE.PDF. That's eligibility altogether, eligibility, ref, guide. And that'll lead you it'll give you an address where you can get this very helpful Tennessee Medicaid chart. And it will show you the exact income limits for all the Medicaid coverages in Tennessee, including children, caretaker relatives, there are many actual different categories of Medicaid that people are eligible for in Tennessee now, if you fall into the income category and otherwise qualify. So bear in mind, if you have children and your income is, I'll just give you some examples here. If your family income is, it gives one person $30,150 for a two-person family size. If your income is for the year less than $40,600, children would qualify either for TennCare or Cover Kids. For a family of three, if it's less than $51,050, that's the limit for the category for the family of three. Family of four, $61,500. If you make under that family income, your children should be eligible for TennCare, regardless of what the parents, the adults, are, regardless of whether or not they're eligible for insurance. Family of five, up to $71,950. Family of six, up to $82,400. Family of seven, up to $92,850. Family of eight, $103,300. That's at the 250% federal poverty level. That's the cutoff for Cover Kids. TennCare goes up to a certain amount according to the age of the child, and then Cover Kids would cover those children up to that 250% level. So again, pull that chart up, and you may see in this chart some categories of Medicaid that you or a family member or somebody you know might be eligible for, and that's eligibility, REF, guide, GUIDE.PDF. And bearing in mind, you can apply for, and most of the coverages, TennCare and Cover Kids, you apply online on the healthcare.gov website, just like you would for the insurance. For the Affordable Care Act, we do have this open enrollment period that ends December 15th. It used to be, I think, January 31st, and our current administration cut it off. But we need to get in there and do this before we get busy with Christmas shopping, because the last minute it gets everything gets busy. There are online phone calls. It's hard to get online. You'll have a long wait if you wait. if you wait till the last minute. Now, Affordable Care Act, it's tricky getting signed up. The amount of income can be tricky. Two major critical factors are important. One is family size, how many people are in your family, and sometimes that's hard to determine. And estimated income for next year. I'm looking at the chart here. If you go into the computer and you're just one person, a family of one, and by the way, the Affordable Care Act counts family size the way you file your income tax. TennCare, Medicaid counts household size different. It's not, it gets, but there are instructions on how you do it. But for the Affordable Care Act, to sign up for the insurance before December 15th, your family size would be how you would file your income tax returns, who your dependents are. And for if you're a family of one, if you estimate your estimated income for next year is going to have to be at least $12,060. If you're one person, and you go in the computer and you put in $10,000 or just $12,000, it's going to shoot you out a premium, a really, really high premium, probably close to $1,000, because you don't qualify for the tax credits. You qualify for the tax credits if you're one person from $12,060 up through $30,150. And you may be like, it's all something that determines the amount of the premium. Also is age. They do. I don't know the exact cutoff, but they do inch up. The older we are, the higher the premiums. For a family of two, you're going to need to have family income to get the tax credits of at least $16,240. That's per year. For a family of three, you're going to need, say, a mother and daddy and a child, one child, you're going to need at least $20,420 of estimated income. Family of four, $24,600, and on up. If you'll go to that helpful chart, the blue part at the top not only shows the amounts that make you eligible for TennCare, but also the annual amounts. Look at the annual amounts, because that's the way the ACA is computed. The Affordable Care Act, your income is determined by your estimated annual income. TennCare, which is Medicaid, is based on monthly income. And I'll say again, if you go into that healthcare.gov website and just start putting in your information, first of all, to cover the adults involved, you're going to need to have these amounts, like for one person at least $12,060, for two people $16,240, and then you have children, you start putting the dependents in, and according to your income, the system will spit you out information saying like so-and-so and so-and-so, the children maybe are eligible for Cover Kids, and the parents are eligible for the Affordable Care Act, hopefully eligible for tax credits. But those figures, and of course, again, one person, $12,060, and this is where Medicaid expansion would help so much. Because if somebody tells me I work part-time, minimum wage, I don't make $12,000 a year, or I have older people sometimes that are younger than 65 drawing Social Security, and it's under that amount. And unless they can legitimately estimate enough income to get it up there, they are out of luck for the Affordable Care Act and Medicaid. And Betty's shaking her finger at me.
Well, I just wanted to add something. Maine, the state of Maine, had a referendum yesterday voting as to whether or not they wanted to accept the Medicaid expansion thing. That citizenship, that citizenry, voted 58.8%, almost 60% of the people want to expand Medicaid. How I wish we could have a referendum in Tennessee. I don't know then even if the legislature would vote it in, because I think the majority, that statistics show that the majority of the people in Tennessee want expanded Medicaid. Remember now, our legislature turned down $3.5 billion that is ours, that is our taxpayers in the state of Tennessee has sent that to Washington, and they wanted to give it back to us, and our legislature would not take it. It would have insured 300,000 more people in the state of Tennessee had they taken it. I will never understand why.
No,
they did not accept the $3.5 billion.
And all because of the only reason they could give is spitting out statistics. The government won't keep their promise. We're against big government. The ideology or ideology, however you say it, of not common sense, and knowing this, they had to know it. Thousands of Tennesseans were going uninsured and still are because they didn't expand Medicaid. Hospitals are closing, have been and are closing. We understand that Tennessee leads the country in closing of hospitals.
Of rural hospitals.
Right, and that hurts everybody, not just poor people, not just low-income people. That hurts everybody.
Hurts the economy, hurts employment, everything.
Right. Who would want to, or what company would want to move into a state that didn't provide insurance for its citizens and could? Now, that it has over the country, the citizens have, as Betty indicated, it seems that people are realizing the importance of health insurance, and I believe last night I saw a statistic out of Virginia. Virginia elected a Democratic governor this time, that as to issues that people were interested in, health care was at the top. And states that have not expanded Medicaid, the people have realized how very hurtful it is, and we so need our legislature to use common sense and do what's right. What is right about depriving people of very basic necessities? And back to the Affordable Care Act, and something I wanted to mention that might be helpful to you. If when somebody calls me about information about the Affordable Care Act, first thing I'll ask them is, how many are in your family? Well, it's just me. What's your estimated income next year? And if it falls below that $12,000 $12,060, I'll probably ask them, do you live with somebody? Does somebody live with you? And they may say, oh, yeah, I live with my sister. Does she have income? Well, yeah, she draws Social Security and she works part-time. And sometimes dependents count. So think, if you're living in a household that somebody else can claim you as a dependent, sometimes that can work. The estimated income, it is estimated at this time. When you sign up this year before December 15th, you're estimating your income for next year, and if there's a big enough variation from what your tax returns have been showing and what we estimate for you for next year, the system may print out something that says, well, within 90 days, you have to send us something, some sort of written verification of what, verifying your income. You know, you can't just throw something out there, just make up something. But we work with that, and I one thing that I try to help people with is the household income and what it's going to take to get insurance. Something else, if you go into the computer, the healthcare.gov website now, is very user-friendly. Something else I might point out to you that makes a big difference in your deductibles and your out-of-pocket maximums. You need to print out, when you print out this form, it just goes up to 250%. Though there's another. Just go into your system and just have it print out the federal poverty levels for 2017 or 2018. 2018. You better do that. 2018 for the ACA, and you'll get a chart. And Al and I were talking about the Silver Plan, and up to 250% poverty level, it pays extra. And so everybody, it's without question, the Silver Plan is recommended for anybody that has income up to 250%. And another very helpful and critical fact to bear in mind is print out that chart, and if you can't find it or don't have it, I'll get you one. It's very helpful because it lists the poverty levels. Like it starts out 100%. That's the $12,060 for one person. And then it goes across 138, 147, 150. People with incomes of 100% to 150% get very good deductibles and out-of-pocket maximums. I think it's $20 deductible and $475. I'm not sure. It's a very low out-of-pocket maximum that you have to spend before it kicks in at 100% then. And then from your 150% over to 200%, the deductible goes up some. So if you're at that, if you're say at the 100, if your estimated income is $18,000, you're probably going to get a good deductible. But if you go to 19 and over, your deductible is going to jump up. It jumps up again at 200%. And if you want to just fool around in the computer, just go in there and put your estimated income in. It's easy to print out an estimate, and because it immediately prints out the deductible that you're entitled to, and then you can go on and see what plan you can get. And I'll help you with it. I'm working now part-time for Mr. Clinton Swafford at Swafford Peters Preston Hall, and I'm usually home. I'm supposed to get out of there at 1 or 2 o'clock. So call me at home and leave me a message, and I'll call you back and help you with this if you want to know some specifics. 962-4982. If you don't have a computer or just don't want to fool with it, 962-4982. And I'll help you with any details, and because it can make a difference if you go in and put an estimated income of $18,000 as opposed to $18,500, say. It's going to kick you up into that higher deductible, and it's good to know that before you go in. Betty, I'm about to run out of steam here.
Well, I wanted to do our commercial again for the real estate and tell you that this is sponsored by this real estate company, which is Keller Williams, and Mike Winton is the realtor who is sponsoring us from that company. And when looking for a real estate agent, call Mike Winton with Keller Williams at 931, lost it again, at 931-224-5969. He's got 10 years of experience and a lifelong knowledge of our Middle Tennessee area. But I also wanted to add, it's also sponsored by the local Franklin County Democratic Party. And I want to tell you the reason that Nancy Silvertooth is so knowledgeable in this insurance. I can't tell you how many hours she spent in training to learn how to help you with the Affordable Care Act. And she has helped numerous people. And by the way, this is a call-in show, but you can also call her at home on the number that she gave you. Don't hesitate to do that. And you've got to do it before December the 15th. Please emphasize and remember that the government has closed the the gap or the amount of time that you have to sign up for it. So that many people won't take advantage of it. Now, see, if we had expanded Medicaid, well, then your insurance premium is going to go up because the legislature did not expand Medicaid, and it's going up real high because we didn't expand Medicaid. So I want you to understand that also. You need to talk to your legislator. Of course, it's too late now. We've lost that money. That $3.5 billion that belongs to the state of Tennessee went to Kentucky, Indiana, California. All those states that expanded Medicaid got our money, and it's already gone. But we had a big window of time that we could have accepted it in the state of Tennessee, and I'm just still overwhelmed by the fact that we didn't do it.
Right. I want to give you a little bit of information. If you just cannot get insurance, either some category of TennCare, Medicaid, or the Affordable Care Act, we have here in our county in Winchester Volunteers in Medicine. Dr. Tommy Smith, a person that I very much admire, retired lately. He's been out here at the Southern Tennessee Regional for years. Been practicing in Franklin County for years. And years ago, he started. I think he's the one that actually did it. Volunteers in Medicine years ago, and people can go there and get free medical care. Now it's not like going to your primary care facility. You don't go there if you cut your hand real bad and you're bleeding. Well, I guess they would help you. They would do something emergency if you came in with something bleeding, but they don't do just regular. They're not an emergency room. I need to get Dr. Smith on here sometime and tell just what they do.
You need to tell them where that's located.
It's located, yes. It's located in the county annex, and it's over, if you go back to the back, over on the side that the ball field is on. You'll be right there at it. When you go into the annex, go to the left part, and up the steps there, you'll see it's at that entrance at the back across from the ball field, and they're just right there. And I've got their phone number. You call and make appointments to see them. What they do is when they're medical people that work there, their doctors and other medical staff are volunteers. They all volunteer, and they set their appointments when they can have someone there. And their phone number is 968-2579. That's 968-2579 to get an appointment. And I want to also remind you that Grundy County does have a federally funded primary care center. It's in Colmont. It's quite a ways from here, but you get treated there by it's a primary care center by doctors, just like you were going into one of our primary care centers here. Because it's federally funded, they treat people, and you pay according to your income. So if you have no income, I assume you're not going to have to pay. And it's at Colmont, Tennessee. Their phone number is 931-779-4002. And of course, it's at a disadvantage having to go to Colmont, but they're very good. And when you have some people will wind up being diagnosed with a very serious health problem, no insurance, and the primary care center or our people out in Volunteers in Medicine could direct you where to go, could help you and direct you where to go to get help. Our health center here, Franklin County Health Center, I think does help some people with some health insurance applications.
Aren't they open just certain days of the week, though?
Well, I thought they were open all the time.
Maybe
Are
so.
they? Okay.
I don't know.
But they do some um, maybe some types of Medicaid, categories of Medicaid, they help with. I know at one point, let's see.
Very often, Nancy Silvertooth has gone out there to help people with their insurance.
I've been out at Volunteers in Medicine.
Yeah, that's what I mean.
Yeah, and I need to go again. I haven't been there in a while. But let me just, the health department may help you with some of these categories of Medicaid that you don't ordinarily, that we don't think about. The pregnant women, these are women's issues. Pregnant women, breast or cervical cancer. Let's see. The caretaker relative. I don't know whether they would do caretaker relative or not, but also online. You can also apply online for these categories. And I'm trying to think where else.
This is just another place you can get help. The health department can also, for reference, to refer you to somewhere to go.
And I'll mention that our Department of Human Services here, they may help you to some extent with the applications for, I don't think they'll help with the insurance, for some categories of TennCare, Medicaid. And of course you realize that Medicaid is the federal program that supplies money to the states, a certain amount of money to the states, and to operate these programs. And then TennCare is Tennessee's pickup, yeah. And one, I'm going to hush after I say this. Cover Kids. We don't say it. We don't often say it, but Hillary Clinton, when she was in there with husband Bill, is entitled to credit for getting Cover Kids. It's called Tennessee. It's called CHIP. The federal program is CHIP, and the Tennessee program is Cover Kids. She tried awfully hard to get health care for all of us. She couldn't do it, couldn't pull it off, but she did manage to get Cover Kids, and that has been a great help to people with incomes that are higher. That makes children ineligible for TennCare, but on up there to the 250% level, they can be eligible for Cover Kids.
Caller called and wanted to know, said, is there anything out there that people can do that can't get insurance because of such high deductibles and high copays? Lady said her husband they don't offer insurance where her husband works, and it's like $500 a month premium with $5,000 deductibles.
Well, of course, if their income levels, it sounds like their income level may be below the category that makes them eligible for the tax credits. Of course, if the income is below the level that makes them eligible for the tax credits and they're not entitled to any category of Medicaid, that leaves them out. Now, if they're in the high income category over the 400% level, they're also not going to get tax credits. And of course, some people are fortunate enough to be in those high income levels.
But that means they can get help medically at these free clinics, but they can't get insurance, is what you're saying.
Well, of course, what makes their premiums really high is either they're in a higher income level, okay?
Yeah.
Because the higher income you go, you are going to fall into higher deductibles, or if their income is below, say if it's a family of two, if their family income is below $16,240 per year, then they're not going to be eligible for the tax credits, and and their premiums are going to be very high because they're not eligible for tax credits. So either
she really needs to call you.
She needs to call me. Yeah, I need to know
some more information
because people with levels of income from low to mid-range, from low, for instance, a family of two here goes up to $64,960 is at the 400% level. If their income is more than that, they're not going to be eligible for the tax credits. And, of course, bear in mind, the Affordable Care Act, the whole purpose of it was to make insurance affordable for everybody. Presumably, if you're in a high income, you can afford it. And so the Affordable Care Act is geared to especially help lower income people. Well, everybody actually. But I mean, if you go up, that's not low income to me. Two people, $64,960 is a pretty good income. But you are going to, at that level, you are going to be in a category of probably $2,000 deductible, and the out-of-pocket maximum is going to be higher. But the only thing that keeps you from getting a marketplace policy with the premium tax credits to help you is income under the 100% level or over 400%.
Right.
Or not being a citizen or some other, So she just needs to call me at 962-4982. Do you understand that? You understand that, Al?
Yeah, I understand.
Yeah.
There's another call.
There's another call, maybe.
Who knows?
It's Karen. Who knows? Yeah.
So what else? We got about 6 minutes.
Ooh.
Will y'all run out?
Well, I was just saying, Al ought to pay us to come out here because he takes off when we're here.
Yeah, he left us here.
I was doing other work that I had to do.
Well, I would just like to point out, when I get my mind on this insurance thing, that alone ought to make people be thinking seriously about getting out and voting for people that will work for actually people-oriented programs. And we had Representative Craig Fitzhugh speak to us Monday night. He's been in the state legislature for 23 years. As Betty says, he's a good guy, just a very ordinary person. Of course, in the Democratic Party, we also have Carl Doon running, so we're not supposed to really show any preference. But I was impressed that when I heard Representative Fitzhugh speaking, he was talking about ordinary things that the Democrats up there in the legislature, they call them the Fighting 25. But they're so outnumbered, of course, by the Republicans. But they fight for things that help veterans, elderly people, the property tax situation that the Republicans did a couple of years ago or more that was a disadvantage to seniors and veterans. They managed to get that back. Finally, got it back to where it was formerly.
They affected 28,000 veterans in the state of Tennessee, and they had to pay the same property tax that everybody else had to pay along with senior citizens, and now they've gotten it changed back so that we don't have to pay that much.
And I don't know who in the state did this, but they got on the subject of that the state had cut benefits to offices like the Veterans Service offices, and how they get those things sneaked in without a lot of publicity just beats me. I didn't know that, but I promise you, if you see a plan out there that actually helps people, it'll be something that the Democrats sponsored. If you see something that helps rich people, the 1%, the 10%, you know where that comes from. And by the way, did y'all yesterday morning? Have I got a minute or two left?
Yeah.
Yesterday morning on NPR on the way to work, I had my radio on. NPR, and they were talking about some study, and I meant to get back on it, that had just come out, and I consider NPR sort of neutral. They don't lean, they stay non-political. But this study that has just been published that has to do with the wealthiest of the wealthy, and it was mostly companies, corporations, that they are these big corporations, maybe global companies, are much more wealthy. And there's just much more things going on that we wouldn't like than we think, than we even imagined or we've heard of.
And this biggest tax break that we've ever had in the history of the United States is going to help them, not us. They are the ones who are going to get the big tax break, the ones who are already filthy rich.
That leaves me out.
I understand totally.
All right, ladies.
Come to our meeting on the 18th, and you can jump right in the middle of this common sense stuff we're talking about, and we do things that actually help people like us, ordinary middle income.
It'll be on the 18th at 9 o'clock in the annex, in the Franklin County Annex, in the small room.
That's for the Saturday morning?
Saturday morning.
9 a.m.?
Right.
All right. Circle your calendar. Ladies, good show.
I was real pleased with the election in Virginia. We got 8 Democrats elected in Virginia, I believe, the other night.
All right.
That's very encouraging.
Thank you guys for being here.
Thank you.
Thank you,
Common Sense Matters on the radio. And let's see here.